You know that feeling after a big bowl of chili, fried food at the fair, or something spicier? Many of us battle heartburn from time to time, but frequent heartburn could indicate acid reflux or gastroesophageal reflux disease, better known as GERD. Joining us now in studio is Dr. Nicholson, minimally invasive abdominal surgeon and founder of Nicholson Clinic and abdominal surgery specialist. Good morning. I just had that feeling after eating fried calamari last week.
Believe
Seriously,
me, I understand.
It'll do it to you. Okay, first and foremost, you are a bariatric surgeon. So how did reflux surgery become a focus of the clinic?
Well, okay, great question, because what we find is that reflux affects a lot of people, but in many cases it can be linked to being overweight. So a lot of our overweight patients also suffer from reflux disease.
Okay, you said that GERD affects, I think, about 20% of us, and the symptoms can be severe. So what are some of the symptoms?
Okay, so about 60 million people in America are affected by this, but the symptoms can range anywhere from heartburn, like a feeling of pain in your chest, regurgitation, feeling food in the back of your mouth, dyspepsia, just an upset stomach, irritation of the lungs, which can lead to hoarseness or a chronic cough, or even eroding the backs of your teeth.
Not everybody who has reflux has GERD. I know you said that, but you say if it's not caught, it can lead to even more serious issues.
Absolutely.
That's the real problem.
That's the real crux of the issue, because it can injure your vocal cords, it can cause chronic bad breath, can cause loss of teeth, or even it's the leading cause of esophageal cancer.
So when should people seek medical treatment? What do you do?
Well, basically, there's no hard and fast rules for that, but once it starts to impact your lifestyle, let's take you, for instance. If you started noticing chronic hoarseness, that would be a huge problem for you, in which case you would need to be seen. Other people, if it's affecting you on a daily basis or medications are becoming expensive, it's just becoming prohibitive, you should be evaluated.
So what's the treatment protocol? What does it involve?
Well, the treatment can range anywhere from simple things like lifestyle modification, stopping smoking, drinking less, or even eating less spicy foods in your case, or eating 2 to 3 hours before dinner. Then you could move into things such as over-the-counter medications or even prescription medications, and ultimately you may want to consider surgery.
Okay, so if somebody ends up on your surgery table, what can they expect? What does this involve?
Okay, so the concept there is, for most people, reflux disease is caused by what's called a hiatal hernia, which is an opening in the diaphragm, the breathing muscle that separates the abdomen from the chest. It allows the stomach back up into the chest. So what we essentially do is fix that hole. In some cases, we'll actually wrap the stomach around itself to install more of a one-way valve.
So you can actually repair the hernia?
Absolutely. And what that entails is 5 small incisions. It takes about 30 to 40 minutes. We sew the hole up, and then also frequently when we wrap the stomach around itself, that prevents reflux from going back up into the chest and thereby fixes the patient's problem.
So one of the things people always worry about is recovery. How long is the recovery?
Yeah, like I said, it's a day surgery with people leaving the same day, and most people are back at a desk job within a week.
So it's an important issue and can be fixed in a variety of ways. If it has to be surgery, it's really not that complicated a process. Is that right?
Absolutely.
All right. Thank you so much for coming in today. I'm talking about an important thing that affects 20% of the population, right?
Accurate.
That's a lot of people. Thank you. You can go to nicholsonclinic.com and click on the abdominal surgery link to watch videos and learn more about reflux and your possible surgery options.
Amped Up, sponsored by the Nicholson Clinic. This is the year you lose the weight and change your life. Call the Nicholson Clinic today.